The thyroid gland is small, shaped like a butterfly, and sits in your neck. Don't let its size fool you. This gland is a powerhouse, producing hormones that control your metabolism. Think of metabolism as the body's engine, dictating how fast or slow it runs. Thyroid hormones impact energy levels, heart rate, temperature, and even how other organs function. When the thyroid works correctly, everything stays balanced. But when it doesn't, it can throw your whole system off. That's why understanding thyroid disorders is crucial. Thyroiditis is a general term for inflammation of the thyroid gland. This inflammation can disrupt the thyroid's ability to produce hormones, leading to various problems. There are different types of thyroiditis, each with its own cause and effects. Some are temporary and resolve independently, while others may be chronic and require ongoing management. The symptoms of thyroiditis can vary widely depending on the specific type and severity. Common signs include swelling in the neck, pain around the thyroid gland, and fluctuations in thyroid hormone levels. Hypothyroidism occurs when the thyroid gland doesn't produce enough thyroid hormone. It's like the body's engine running out of fuel, slowing everything down. Common symptoms include fatigue, weight gain, feeling cold, constipation, dry skin, and difficulty concentrating. Hypothyroidism is more common in women and people over 60. If left untreated, it can lead to serious health issues like heart problems, depression, and infertility. Hyperthyroidism is the opposite of hypothyroidism. The thyroid gland produces too much thyroid hormone. It's like the body's engine is stuck in overdrive, making everything speed up. Common symptoms include weight loss, rapid heartbeat, anxiety, tremors, sweating, and difficulty sleeping. Hyperthyroidism can also lead to serious health problems if left untreated, such as heart problems, osteoporosis, and eye issues. Section 5. Subclinical thyroidism, a hidden imbalance. Subclinical thyroidism is a mild form of thyroid disorder. In this case, the thyroid hormone levels are slightly outside the normal range, but you may not experience noticeable symptoms. Subclinical hypothyroidism involves slightly elevated TSH levels with normal T4 levels, while subclinical hyperthyroidism involves slightly lowered TSH levels with normal T4 levels. While subclinical thyroidism might not cause immediate problems, it's essential to monitor it as it can progress to overt hypothyroidism or hyperthyroidism over time. Section 6. Hashimoto's and Graves', the immune system's role in thyroid problems. Sometimes our own immune system can mistakenly attack the thyroid gland, leading to autoimmune thyroid disorders. Hashimoto's disease is the most common cause of hypothyroidism. In this condition, the immune system attacks the thyroid gland, damaging it and reducing hormone production. Graves' disease is the most common cause of hypothyroidism. It causes the immune system to attack the thyroid gland, but instead of damaging it, it causes it to overproduce hormones. Both Hashimoto's and Graves' diseases are more common in women and often have a genetic component. Section 7. Unmasking the culprit. Diagnosing thyroid disorders. Diagnosing thyroid disorders involves a combination of a physical exam, review of your medical history, and blood tests. The most common blood tests are TSH, or thyroid stimulating hormone, T4, also known as thyroxine, and T3, which is triiodothyronine. These tests measure the levels of different thyroid hormones in your blood, helping doctors determine if your thyroid is functioning correctly. Additional tests, such as antibody tests, can help identify autoimmune thyroid disorders like Hashimoto's and Graves' disease. Section 8. Restoring balance treatment options for thyroid conditions. The treatment for thyroid disorders depends on the specific condition and its severity. Hypothyroidism is typically treated with synthetic thyroid hormone replacement therapy, taken as a daily pill. This medication helps restore the hormone levels to normal, alleviating symptoms and preventing complications. Hyperthyroidism treatment aims to reduce hormone production. This is achievable through anti-thyroid medications, radioactive iodine therapy, or surgery to remove a part or all of the thyroid gland. For autoimmune conditions, medications to manage the immune system might also be necessary. Section 9. Early detection, effective management, your thyroid health matters. Thyroid disorders are common but often go unnoticed due to their subtle symptoms. Understanding the signs and symptoms is crucial for early detection and treatment. If you suspect a thyroid problem, consult your doctor for proper diagnosis and personalized management. By prioritizing thyroid health and seeking timely medical attention, you can effectively manage these conditions and live a full and healthy life.